Okay. Good evening, everyone, and thank you for attending tonight's Tough Topics discussion. The Tough Topics series was created to provide a safe space to discuss subjects that you may be afraid to ask about. As librarians, we are here to help, not to judge. This year, Shreve Memorial Library has partnered with the Louisiana Department of Health, Office of Public Health Region 7, to bring you a series of discussions on opioid addiction and substance abuse. Tonight, we have Andrew Ameen, Crisis and Outreach Team Director at CADA, the Council on Alcoholism and Drug Abuse. Andrew's presentation tonight will cover anti-overdose reversal and Narcan training. Before we begin, I'd like to ask everyone to please complete the free survey if you have not already done so. The link to the survey is provided in the chat box. Also, I'd like to remind everyone to please keep your screens on mute and submit any questions you may have through the chat box feature. Now, without further ado, Andrew, I'll turn it over to you.
Great, thank you. Thank you, Samantha, for hosting this in the Shreve Memorial Library. And they're not on here, but thank you to the Office of Public Health and the Louisiana Department of Health. Yolanda Duckworth is who reached out to me to get me in here, so I appreciate that. Let's go ahead and do the screen share. And then, yes, we're gonna share sound, and yep, gonna do that. Okay, how are we looking?
It's looking a little pixelated.
Is it looking pixelated still?
Yes.
Let me try it again.
Okay.
Okay.
There we go. Looking
Okay.
much better.
That's what we had to do last time, was the in and out. Okay.
Gotcha.
Okay, cool. So here we go. Yep, my name is Andrew Ameen. I'm with CADA, it's the Council on Alcoholism and Drug Abuse of Northwest Louisiana. We are a contractor of the Louisiana Department of Health. So we've been contracted with them to provide treatment services as well as to do some prevention work. So as a member of the LeSource outreach team, I'm one of the managers on the team, and also I am involved in prevention work. So that's really what this Narcan training is a part of. It's a prevention tool. We're also going to talk about some evidence-based practices and drug prevention methods and some ways to safely dispose of medications today. So there we go. So on the left is an outline of what that grant is that I was talking about. So it's Louisiana State Opioid Response Grant is a lot more than just this outreach team, but it is a part of it. So it's about a $12 million grant. Phase 1 just ended at the end of September. Phase 2 just began in October, but with everything, like, they don't have the little perfect piece of paper like this for phase 2 yet. But it's very similar, just they've changed some things, made it a little different. But so in this, it provides prevention. That first bullet point talks about prevention, a little bit about what we're going to talk today. The second bulletin under overview talks about MAT, which is medication assisted treatment. So it's not just about prevention. It's not just providing a crisis service. That MAT portion is management treatment for people with an opioid use disorder providing them treatment over an extended period of time. Outreach services is part of what we do here at CADA. It's been a target of the grant to try and go and connect with pregnant women and families of women with opioid use disorder to connect them to treatment. CADA is involved in that as well. At our residential treatment, we have what we call our family program, and that's for women seeking treatment with not just an opioid use disorder, but they can get on treatment and they can bring their children in or stay on their maintenance while in a residential setting. And then also add treatment. One of the things they did was try and connect people not just into specialty clinics for medicated assisted treatment, but actually to primary care physicians and to like general practitioners, as opposed to going to a specialty clinic like a methadone clinic specifically. It's something you can actually get connected to at your primary care doctor, get those doctors waivered so you don't have to change your doctor or have multiple doctors to just have, to stay on your maintenance program. So, what is all this for? The LeSoar grant, what's our goal? It's to stop it. So my cheesy pun for the night. I thought it's weird because I can't hear anybody giggling at my bad joke, but
it's cute.
Thank you. Thank you. Little positive reinforcement is all I needed.
And before you go, can you minimize your participant screen? It's blocking part of your slide.
Oh, I'm sorry. I didn't realize y'all could see that too. I was hoping I would get to see faces over there, but okay. Okay, so what are we trying to stop? With all that, with that $12 million, it got boosted up for phase 2. It's more money than that. What are we trying to stop? Addiction's kind of a dirty word in substance use treatment now, but it's really what the common vernacular is. It's really changed to use disorder, returning to use, someone with addiction is not the phrase that it wouldn't be considered recovery language anymore, but it's what everyone thinks of when we think of something like opiates, methamphetamines, cocaine. Addiction is what comes to mind. So we're trying to stop substance use disorders. We're trying to prevent overdose. And more than anything, it's a harm reduction tactic. We're trying to prevent deaths. We're not necessarily just going for the perfect solution, which is, with addiction and substance use disorders, perfection is, someone quits using, they achieve total enlightenment, they go on, live their life, whatever that means for them. But that's sometimes fairy tale. A lot of times what our goal is if someone is using 100 milligrams of something a day, well, maybe we can bring it back to 50, and that will bring back a certain level of quality of life, improve their quality of life, and bring them back into the folds of society. And then we can start working on other aspects of their life. And but overdoses and death are really what we're trying to prevent. And so here is a nice little diagram to show you just how complicated trying to work with and solve someone's substance use issues. So you'll see at the top or in the middle, the blue circles with the arrows pointing, it's kind of the cycle of addiction. You have the treated abuse state, you have the remission state, and you have the abuse state. And then you have the arrows pointing in between. And so what really the Department of Health and the Office of Public Health is trying to get in between those arrows and hopefully get people to the treated state and get people into the remission state to avoid having people go towards that red circle for the overdose event. That leads to that black circle, which properly colored, of death. And it has become, I don't want to say the word, but it's become almost a pandemic. in and of itself. In 2017, there were over 70,000 overdose deaths in the United States. That went down in 2018 a little bit, and then right back up in 2019. And they're seeing an increase this year as well on the preliminary numbers. So all of this grant is to connect people to services or to prevent them from needing to seek those services and fill in the gaps within this treatment. It's not a wheel, but this treatment cycle, to hopefully keep people in remission or in treated states and reduce the harm that comes with returning to the abuse state. So here are some specifics on overdoses in Louisiana, or deaths, sorry. So you'll see the trend of why so much money is going into opiates and opioids. This is a trend that's being seen nationally, especially in coastal areas, big cities, port towns, places where you see poverty. You will find increasing amounts of overdose deaths in the last 20 years specifically. You can see in those last 5 years. And if you look at synthetic opioids, that's where you'll find like what's really happening and where the real change is coming. Yes, you see an increase in heroin. Yes, you see an increase in the prescription opioids, but going from 29 deaths from a synthetic opioid in 2014 to 154, 4 years later to 215 just a year after that. There's a real problem with fentanyl and synthetic opioids in the United States, and that's what's leading to so many of these overdoses. And at the bottom, you'll see our target demographic is people aged 25 to 44. That's where the majority of deaths are happening. And I don't have the graph up here, but there was a graph that went with this. About 60% of that 57%, 63% of that 57% were males. So males aged 25 to 44 are really who's reeling from this opioid epidemic. And so what are those? Fentanyl, you can read it, 30 times stronger than heroin, 20,000 Americans in 2017. Carfentanil, which is basically a horse tranquilizer, it is 5,000 times as potent as heroin and 10,000 times as potent as morphine. So it's crazy to think about how strong, if you've ever had morphine for a medical situation, how strong morphine is. It's 10,000 times as potent as that. And these things claim the lives of people around the world, not just in the United States, and not just in Louisiana, every day. So here's a chart showing the increase of those synthetic opioids. Fentanyl runs right with it because it's the main culprit, along with carfentanil and some other ones that are hard to say. But you'll see one that hasn't gone up in the last 4 years and really hasn't gone up in the last 40 years is methadone. Methadone is used in the treatment of heroin addiction and opiate addiction, and it's considered a much safer, more stable opiate, longer lasting, and you see much less deadly and much safer than any of these other opioids listed on here. Okay, and so here's some breakdowns by parishes, just so you can see where this is happening in Louisiana. And for the majority, it's kind of isolated into the toe of the boot. We do have this up here in Northwest Louisiana. I'll show you in the next slide, or in a couple slides, why that is. but where it is, it's isolated around these, you know, New Orleans and Jefferson and New Orleans. You've got East Baton Rouge, St. Tammany outside of there on the West Bank, and then Washington going up into like that Mississippi, I think they call it the Florida parishes. It really is isolated up there, and you can see it represents about 66% of the deaths. So here's a breakdown of how this is treated by the Louisiana Department of Health throughout the state. We are in the top left, the yellow portion, District 7. We have the Office, Louisiana Behavioral Health, Louisiana Office of Behavioral Health. Our, what's called the OPOT is, or OTP, is on Line Avenue. It's called the Center for Behavioral Health. It is the representative, it's the methadone clinic in town, or really for our district. There's a lot more buprenorphine providers that is much less regulated and much more available to people than methadone. It's much more controlled in the state of Louisiana. So, but this is also for all of the Louisiana Department of Health and Office of Public Health. They follow this same chart. So we go from CADA over to Claiborne, down to Natchitoches, and to the western border in DeSoto and Sabine. And so that is the area we cover. And we provide this Narcan and the rest of what we're going to be talking about all over those 9 parishes. So CADA, so we talked about it mainly being an issue for these overdose and these deaths. Like that's where the bulk of these deaths are happening. But you can see in central Louisiana, Rapides is like the Alexandria area. And CADA up here in Northwest Louisiana, like there's more than 1.5 opioid prescriptions per resident. So there's more than 1.5 prescriptions per resident in this parish. And so if you think about it in a way, how many people don't in a year get a prescription for opiates? It's the vast majority of people don't end up with a prescription for opiates. The vast majority of people aren't written a prescription for Percocets or for Oxycontin or Loratabs in a year. It's been 12 years for me since I've been written a prescription. So a lot of these prescriptions get funneled into smaller groups of people. Like I say, like a certain portion of the population takes up the majority of these prescriptions. But that is highly concentrated. That is a lot. And then you can see down the Lafayette area, and it is represented in our treatment community. We see a lot more pill use up in CADA, which is representative, like this represents, we see a lot more people coming in with Percocet, Loratab, Oxycontin use disorders than heroin addiction coming into our treatment centers in the Northwest Louisiana. So with the prevention, what our goal is, I work with the Office of Behavioral Health, Serenity Gardner. She is really overall the prevention in the area. She's the go-to person. She's fantastic. But what we do is we've been charged with implementing evidence-based programs to assist statewide. So what that is that's Generation RX. That's a program that we go out in the community and try and teach people safe medication practices. We've been given money to buy prescription drop boxes and place them throughout the district and connect people and let them know where those are already in the community. And then we distribute Narcan kits and do trainings as well. Okay, so Generation RX. We're gonna watch a short video in a second that'll explain that. but it's an evidence-based practice that's basically trying to stop, that is trying to prevent opiate use disorders. And the way they do that is they look at the scope, causes, and consequences of misusing our prescriptions. They want to identify 4 key messages of safe medication practices, and how to take action at home to prevent people from taking our medicine without our permission. So, oh, gotta take that out. All right. Coming in hot.
Prescription medications are an important tool healthcare professionals use to help people feel better. But when used in the wrong way, they can be just as harmful as they are helpful. Unfortunately, millions of people in America misuse medications, and thousands do so for the first time every day. This can lead to serious legal, social, and health problems, with drug overdose representing the leading cause of accidental death in the U.S. So it's easy to see how prescription drugs can be dangerous for you and your family if they're not used and handled safely. These risks apply to everyone: teens, college students, working professionals, seniors, and even children. There is no particular type of person that misuses prescription drugs. It can happen to any of us. And while it's true that some people do it intentionally, it's often the case that people misusing prescription medications aren't doing it on purpose. It could be an older adult accidentally taking their prescriptions differently than prescribed, or a parent who hasn't properly stored pill bottles out of reach of a curious child. Oftentimes, it's a person that's become dependent on pain medications after an accident, or even something as routine as a dental procedure. The good news is that all of these situations can be prevented, and that's just what we've set out to do. We're Generation RX, an educational initiative that's been promoting safe prescription medication practices in the community since 2007. Our mission is to educate people of all ages about the potential dangers of misusing prescription drugs. Today, Generation RX is being embraced by families, teachers, caretakers, and community leaders. Healthcare professionals are also using Generation RX to better educate their patients. Our tools are designed for everyone. Our free online resources raise awareness and provide guidelines for preventing prescription drug misuse. They also help bust common myths about safety and legal issues. These ready-to-use tools are perfect for educating yourself and others on safe medication practices. You can use them at home, in schools, in the workplace, at senior centers, or just about anywhere people should know about medication safety. Start making a difference in your community by clicking Take Action on our homepage. It's the first step you can take towards safe medication practices for life, for yourself and others. Medication safety starts with you. And be sure to share GenerationRx.org with your friends and family. Generation RX, safe medication practices for life. Brought to you by the Cardinal Health Foundation and the Ohio State University College of Pharmacy.
Okay, so that's Generation RX. We do this. It's a little harder right now with coronavirus and COVID season to get out in the community and hand stuff out. You know, it's awkward going in somewhere and trying to hand out flyers right now, but we're tasked to do this. And so along with this, we take out drug disposal bags. Can y'all see me? I can't remember. Can you see me?
We can see you. If you hold the bag up a little bit higher, well, there you go. Perfect.
Perfect. Okay. So these are drug disposal bags. So they're called the Terra Drug Deactivation System bags. What they're for is to get drugs out of the home that are either expired or you no longer need. And we have a ton of these that we can get to you, we can get to your church, we can get to your family members. We've brought them up to the libraries before. We can bring them up there and drop them off. This is because one of the #1 ways that people end up with pills, especially at younger ages, is through taking them from family members. I like to get my words straight. What's the one place people can go into our homes where we're not with them and they just have kind of free reign over all of our stuff? Visitors, the one place they get to go is into our restrooms. Yeah. And where do we keep our medicines as a general rule? That's also in our bathrooms and our medicine cabinet. And so I've had pills stolen from me. I'm in recovery myself. I have taken pills out of people's medicine cabinets. I know people that have done it. It is a common thing. So leaving medications that have street value in our bathrooms is not safe. Neighbors will come in and take them. Grandkids will come in and take them. Nieces and nephews will come in and take them. Children will come in and take them. So instead of after, whether it's an oral surgery, having a tooth pulled, you sprain your ankle, you have a serious surgery and need them, instead of leaving medications in our medicine cabinets for them to get taken by somebody else, we have these deactivation bags. What you do is I get them to you, you take them home, you open the bag, dump in the pills, add water, and throw it in the trash can. The pills are destroyed. It doesn't go into the water supply. It turns basically into a rock. The bag breaks down and it ends up at the landfill. So we have those. My contact information is in this presentation somewhere. If you need these, get in contact with me or get in contact with CADA. So the big takeaway for Generation RX is only use prescription medications as directed, never share them, always store your medication securely, and be a good example by actually doing it in front of your friends, family, and children.
Hey, Andrew, before you move to your next slide, we had a request to show the bag one more time. Thank you.
You're welcome. Okay, so another thing that we've been tasked to do is get medication drop boxes out in the community and connect people to them. So we've purchased some, placed some, we've got more to place. But here are some places in town that have them that are open to the public. Shreveport City Hall has it. State Troop B has one. The Bienville Courthouse, if you're out in the eastern parishes. The DeSoto Sheriff's Department have them in Mansfield and in, I can't remember the name of the other substation. In Bossier as well, there's one at the CVS at the corner of Barksdale and the street that Jimmy Davis. There's several in Shreveport at CVS's and Walgreens. And if you see the bottom, there's safe.pharmacy/drug disposal. That is a link. If this gets sent out, you can actually go to, click on it. You put in your zip code. And it brings up where CVS actually has them in the community. So that's pretty cool. Like you can see Mansfield Road, Barksdale Boulevard. So bring it out and it'll actually, it'll show you where they got them. So you got one in Minden too. Cool. Okay. Now to the Narcan. What we've all come here to see, what we've all been waiting for. What is Narcan? So Narcan is an overdose reversal agent. It is a nasal spray of the prescription drug Naloxone. Naloxone is an opioid antagonist. So what that means is it actually attaches to receptors in the brain and keeps the opiate from attaching to that same receptor. So think of it as well, we'll get into a little bit of the technical stuff. So what happens what causes an overdose is when someone takes too much heroin, Percocet, Oxycontin, Lortabs, heroin, fentanyl, they come into contact with it. It's not always recreational. They mentioned one of the number one way that people overdose is by accident. Most of them are accidents, and a large number of those are using legally prescribed medications. So it's accidental. So what happens is you take too much of your medicine, you take too much of the drug, and your receptors in your brain get flooded with that drug. And when those receptors get flooded, they can no longer communicate to our respiratory system to make our diaphragm move. So our diaphragm gets basically spasmed. And then when the diaphragm can't move, well, it doesn't pump the lungs, so nobody's getting any oxygen. So what the Narcan does is it actually goes into the bloodstream, goes into the brain, cleans off the receptors, partially attaches to them, blocking the other opiate from getting onto that receptor. But since it's only partially blocking it, it actually allows that communication to start happening between the brain and the respiratory system, allowing that diaphragm to start pumping so that the lungs can start bringing in oxygen again. So it's a pretty incredible drug. It was invented in the 60s, and they've been using it as an injectable, but it's within the last 10 years that they actually made it into a nasal spray that's easy to use for the general public. And with so many people dying nationwide, this is giving, realistically, hundreds of thousands of people a second chance at life, a second chance at getting into recovery. I mentioned that some of this is harm reduction. It's not about perfection. It's not about taking somebody and doing a complete 180 overnight. Sometimes it's baby steps, and all it is it's giving someone the second chance at life, giving them another chance at recovery. We're going to talk a little bit about how to use it, and we're going to watch a video. It is simple. The reason we are allowed to give this out to the general public is because it is extremely user-friendly. And I'll say there is a couple things. There's a standing order that basically protects anybody, allows us with a short training to provide this to anybody. So as long as we tell you about it, tell you how to use it, we can provide it to you so that you can save someone's life too. The other thing is you're protected using this by what's called the Good Samaritan law, which basically means that if you give this to somebody in the good faith that you're helping them out, even if there's a negative outcome, you cannot be held legally responsible. You, your company, whatever. It's the same thing with CPR. Sometimes with CPR, you give somebody CPR, you end up cracking somebody's ribs, or they don't make it and the family tries to sue. Same thing, you're protected under that Good Samaritan law. They can actually sue. So we're going to talk about the signs and symptoms, how to identify the overdose, how to use the Narcan, and what to do once you've used it. So this is the quick start guide. Here's what the box of Narcan looks like. This quick start guide that's on your screen is right here on the front flap of the Narcan. Inside the box is 2 little nasal sprays. Looks just like this. This is one of the trainers that if we were in person, I'd be handing to everybody and we'd be putting coronavirus all over it. So we'll get to that too. So it's identifying, it's giving the Narcan, and then calling 911 and getting that person medical help. So let's get into, the hyperlink's not hot. Okay, so I brought it up just in case that happened.
Opioids like Percocet or Oxycontin, or illegal opioids like heroin. then you should know about the risk of an accidental, life-threatening opioid overdose. In fact, over 56% of overdoses happen in private homes beyond the immediate reach of doctors and nurses. There's a way for you to help someone who is experiencing an opioid overdose, even if you don't have specialized medical training. In this video are instructions for use, as well as the uses and safety information you should know for using Narcan. But first, it's important to be able to recognize the signs of an overdose. Signs of an opioid overdose include not waking up or responding to your voice or touch, breathing that is very slow, irregular, or has even stopped. The dark center part of the eyes becomes very small, sometimes called pinpoint pupils. Fingernails and lips turn blue or purple, a slow heartbeat, weak pulse, or low blood pressure. If someone has these signs, here's how you can help. Narcan nasal spray is a medicine that reverses the effects of an opioid overdose. Narcan nasal spray is not a substitute for emergency medical care. Repeated doses may be necessary. As with any drug, you need to be aware of important safety information about its use. Please pay particular attention to the indications and important safety information at the end of this video. Also, please see the accompanying full prescribing information in the use of this product. Narcan nasal spray was designed for use wherever an emergency opioid overdose happens. Because it doesn't require specialized medical training, it can be given to someone by following these instructions. First, lay the person on their back. Then, remove the device from the box and peel back the package. Hold the device with your thumb on the bottom of the plunger and 2 fingers on either side of the nozzle. Tilt the person's head back and provide support under their neck with your hand. Place and hold the tip of the nozzle in one nostril until your fingers touch the bottom of their nose. Press the plunger firmly to give the dose into the person's nose. After giving the dose, remove the device from the person's nostril and move them on their side, positioning their hands under their head. Call 911 and get emergency medical help right away after giving the first dose of Narcan nasal spray, even if the person wakes up. Narcan is not a substitute for emergency medical care. Keep the person under observation. If the person doesn't respond by waking up to voice or touch or breathing normally after 2 to 3 minutes, administer the second dose provided in the box in the alternate nostril. If they respond and the signs of an opioid emergency have returned after Narcan nasal spray is given, then give another dose in the alternate nostril using a new device and watch them closely until emergency help is received. Additional doses may be given every 2 to 3 minutes until they respond or emergency medical help is received. After using Narcan nasal spray, put the device in its box and then dispose in a place safe from children. Narcan nasal spray delivers a consistent, concentrated 4 mg dose of naloxone that can reverse the effects of a life-threatening opioid overdose in minutes. Visit Narcan.com to learn more. There's a way for you to help someone who is experiencing an opioid overdose, even if you don't have specialized medical training. Indications and importance.
We're not going to get into the, not going to get into all that. Okay. There it is. Okay. Oh no. Oh no. There we go. Okay. So, talked about the signs of an opioid overdose, looking for the blue tint in the lips, fingers, or skin. Breathing is slow, irregular, erratic, or stopped. Pinpoint pupils, unusual sleepiness or drowsiness. So, I like to point out these are almost the exact same symptoms of someone having a cardiac event. So someone has a heart attack or goes into cardiac arrest. These are very similar symptoms to that. So I mentioned just briefly earlier, like I'm in recovery. It's really how I got into this work. So I'm in recovery. If I start showing signs of these symptoms at 29 years old, like hopefully someone will think, maybe he's made a horrible decision and maybe something like this is happening. And because I almost always have Narcan around, they would try and give me the Narcan. They would lay me down, go through, and they would recognize and see, maybe this is a shot. Okay. So they made the decision, they looked, they saw the signs and symptoms, it makes sense, give them the Narcan, using their judgment. my grandfather is an 83-year-old man who's had 4 heart attacks, quadruple bypass surgery. He does, even when he has surgery, like he throws the pain pills away as fast as possible. He has zero interest in them at all. If I walk in and my grandfather has a blue tint to his lips, finger, skin, he's gargling to breathe, you know, I can't wake him up, I'm not going to waste my time on Narcan. Like, I'm going straight into CPR. I'm calling 911 because he's had another heart attack or he's in cardiac arrest, whatever it is. Like, I'm not wasting my time with Narcan on him. I'm going straight into CPR. So there, you know, there's some judgment in how to use it and when to use it. But the great thing about it is even if I gave it to my 83-year-old grandfather having the cardiac event, it's not going to hurt him. There's no negative side effects to giving Narcan to someone. It will only reverse an opioid overdose. So something like Oxycontin, heroin, Loratab, Percocets, but it will not have a negative side effect to someone who's had a cardiac event or they've drank themselves until they passed out and stopped breathing, or they've taken too much of something like a Xanax. Okay, so that's checking the signs and symptoms. What do we do once we have, you know, seen it, we've looked for it, we've addressed it, and we go, okay, we've got an opioid overdose? First thing you do is try and wake somebody up. Is, you know, try and shake them, tap them, talk to them, ask if they're okay, and then we're making the decision we're going to give them the Narcan. It's try and get them safely onto their back. And then they've got a cute little slogan: peel, place, and press. So once we get them on their back, we're going to peel open the package. We're going to pull it out. We're going to peel back this flap. I'm not going to really open that one because it's still good and can go to somebody. But in here, got this one. The tip will go into somebody's nose, and then you push the plunger once it's inside their nose. You don't need to prime it. Don't push it until it gets in their nose because you will waste the shot. It has 1 shot per cartridge, and inside of it is 2 blister packs inside of each box. So remember, get them on their back and then peel, place, and press the plunger firmly. Okay, so I'm going to nail this right at 6:50. So we have 10 minutes for questions. The next is, like they said, this is not a replacement for emergency services. This is Naloxone Narcan is a fast-acting agent. It also, because it works so quickly, it wears off quickly. Someone can actually have used so much of a substance that when you give them the Narcan, they'll come out of the overdose, and then if they don't get medical help, the Narcan can wear off and they can go back into that overdose and pass out and stop breathing again. So it's important to get them into the emergency room, call 911, get them emergency services. Don't let them just get up and walk away. Because, real quick, if somebody is chemically dependent on opiates, when you give them the Narcan, they will immediately go into what is called acute withdrawal symptoms. So it will be like they've gone 3 or 4 days without any of their medicine or their drug. So they'll wake up irritable, sick, angry, but most importantly, they're going to wake up. They're going to be alive. And they'll have that second shot. So call 911. This is just a CPR, like a flow chart for CPR as well. And if you're waiting on emergency services, if you give them the Narcan and they don't wake up and you're comfortable with going into CPR, you can go into compression CPR. Also, another important thing to note is you cannot overdose someone on Narcan. It is not an opiate itself. They cannot overdose. It brings them out. So if they don't wake up from the first Narcan, you go into CPR and they still don't wake up, you've called 911, you can actually grab the second blister pack, lay them back on their back, and give them another dose of the Narcan. And once they wake up, you move them into what's called the recovery position. And so in the little bottom right or in the little bottom center of the screen, you can see it's basically put them on their left or right side. You take their top leg and you pull it over so that they're resting on their knee, and you take their top arm and put the hand under their head so that it's protecting their chin and their head, and it's propping them up. And that way, if they vomit, they don't end up aspirating on anything. Okay, call 911. Okay, so resources, CADA, there's our number, 222-8511. If you ever need any buprenorphine services, Sublocade services, Shreveport Behavioral Health Clinic, Northwest Louisiana Human Services District, they're up on North Hearn. Their number is 676-5111. And then for methadone and buprenorphine treatment, it's the Center for Behavioral Health at 425-3400. CADA also has outpatient, residential, education services, prevention. We run the gamut of services when it comes to addiction and treatment services. So if you ever need anything, the three of us will hopefully be able to figure things out. Again, if you need Narcan, if you need the doTERRA bags, if you want a presentation, if you want more education, call CADA 222-8511. Here's sources from where I got my charts and graphs and stuff, basically where I took things from to show you the goods. All right, that is everything. All right. I nailed it, 651.
You did. I want to thank you for doing the presentation, and I just want to remind, if anyone has any questions, please go ahead and submit those through the chat box, and I'll be happy to ask them to Andrew.
Okay. How do I just, oh, there we go, cool. Now I can see people again. Well, I can see you, Samantha, nobody else is.
No problem. This was a great presentation. I learned a lot, so thank you. And I think we don't have any questions right now in the chat box, but if you wouldn't mind maybe sharing the bag one more time, now that we can see your full face on the screen, we might get a better view of the bag.
That's the back of it. And like I said, we have a bunch of these. And when we get low, we'll order more. We were getting a bunch of them out before COVID season hit. But it's hard to get out in the community. You can't see my arms, I've got them out. It's hard to get out in the community and get this stuff out to people right now.
Understandably. Well, we haven't gotten any questions, but we do have a comment that it was an awesome presentation. So again, thank you so much for being part of our Tough Topics discussion.
Well, thank you, Cecilia. Oh, got the clapping hands from Yolanda. Thank you.
Yeah.
Thank you, thank you. Okay.
Okay. Well, if there are no further questions, I want to just say thank you to everyone that tuned in tonight for our Tough Topics discussion. We will be hosting these each Thursday in October at 6 p.m. via Zoom. And for those who weren't able to make it tonight, I have been recording this presentation. So after we're done, we'll upload it to the Shreve Memorial Library YouTube channel. So anyone that wasn't able to make it, they can check it out on their own time, and I encourage everyone to tune in next week.
I just saw Yolanda's feedback. How bad, or her, how bad was my feedback? I hope not too bad.
Oh, no, it wasn't too bad. It was tolerable.
Okay, I'm sorry.
We didn't want to interrupt you, so you were on a roll, so no worries.
I usually just get to talking and stuff starts flying out, and then it's 20 minutes later.
And when you did that, I kind of didn't hear the hissing.
Yeah,
I gotcha.
It wasn't bad.
No,
okay.
Yeah.
Well, thank y'all again so much. Thank you, Samantha, and thank you for asking me to do it, Yolanda.
Absolutely, absolutely. You guys have a great night.
You too.
Thanks, everyone.
Bye.
Bye-bye.